Welcome, everyone. Thank you so much for joining us today. We are talking about uh, getting help with mental health and the fact that it is easier than you think. And this session is being hosted by Salam Foundation. And before we get started, I'll just hand it over to Sajida Habib, the founder of Salam Foundation, to say a few words, and then we'll be on our way.
Thank you, Farhana. Welcome, everybody. Assalamu alaikum. Salam Foundation was started during COVID when we got a lot of requests from single parents, senior citizens, food banks. So that was really just meeting the needs of food and help with groceries and stuff. Then we got involved with the newcomers and with the single parents, and very big with the women's shelters. We realized that there's very little mental health available. The women and children in the shelters have to wait for months at a time to get in. So our main mandate is for mental health help. And Farhana has been kind enough to host all these sessions. We've got Annie on today to talk about mental health. And if you ever want to know more, you can contact Farhana or myself. Okay, Farhana, you can take it on.
Perfect. Thanks so much. So we have today Dr. Annie Hadi. She's a family physician. She has completed training at University of Toronto, Sunnybrook Health Science Center. And in addition to being a family physician, she has a particular interest in mental health, and then went on to pursue additional training. And she has a fellowship in Cognitive Behavioural Therapy. What's really cool about what Dr. Annie does is, or Dr. Hadi does, tell me what you prefer.
Either way, used to Dr. Hadi though.
Dr. Hadi, perfect. Is she now offers OHIP covered psychotherapy for patients. And honestly, I didn't know that that was something that was possible. So I'm sure that there might be a lot of people out there who are interested in learning more. And for those who are listening who are not in Canada, or in Ontario in particular, we're lucky enough to have health coverage that's covered through the government. So not everything that we talk about today is going to be about that. But if you are in Ontario, then you'll be really interested to know what's available to you, because I think sometimes that's a big issue that we have. We don't know what's available to us. What the psychotherapy does is it covers a variety of different disorders, starting from depression, eating disorders, and a whole bunch of stuff. So we're going to be talking about some of those things, and Dr. Hadi is going to be giving us all the background. And so I have a whole bunch of questions, and I know that people on the call are going to be having questions as well. Awesome. So before we get started with my questions, is there a place that you'd like to start, maybe just as an overview, or there's something that you might want to add from the background that I might have missed?
No, I think you did a great job introducing me. And so just a bit more information about myself. So I do, the full gamut of family medicine, and I have been for over 7 years now. When I did my undergraduate before medical school, I did it in psychology. So I always had an interest in mental health. And then as I was developing my practice and taking on patients, I naturally ended up collecting a bunch of patients that had mental health issues. And in Ontario in particular, especially since COVID, mental health needs have gone through the roof, and we don't have enough psychiatrists to just manage, basic mental health stuff, let alone, psychotherapy and things like that. So family doctors have been now become first line where mental health is concerned. And most of the time we end up managing a lot of complex issues, just because if you wanted to see a psychiatrist, you might be waiting 6 months to a year to do so.
Wow.
And so a lot of people have had to take the extra training to be comfortable with medication prescribing in complex patients, as well as some of the therapy aspects of it. And across the board, I don't think there's really any psychiatrist, though they are trained in psychotherapy, that has the time to be able to do psychotherapy at this point, because they're managing all of the really complex patients, and just volume is way too much. So that's sort of what, I saw a huge need for it about 7 or 8 years ago when I started my practice. And that's sort of what led to me taking a bunch of different courses and then the fellowship, to be able to do that.
Mm.
Mhm.
And it's really quite comforting to be able to just go to your family physician, right? Because you already have a
Yes.
relationship, you trust them. And so it's so much easier to start there as opposed to
Mhm.
finding a stranger and then telling them your deepest, darkest problems.
This is very true. Yeah. And that's really nice because I already have a rapport with most of my patients. And I do get referrals as well. And, we do eventually develop a rapport, but you're right. For a lot of patients, it's a very difficult thing for them to talk about.
Mhm.
And to come and actually ask for help or say that I might have a mental health issue. It takes a lot of courage and guts for them to do so. So if they're doing it with somebody that they already know, it is a lot easier to approach your own family doctor than it would be to a random walk-in clinic doctor or urgent care or Emerge or anything else.
That's great. Now, I know a lot of people are going to ask,
Mhm.
where is your practice and do you take patients? So let's just take that, get that out of the way, because I know there's going to be people who are going to be asking, and probably if we have people joining a bit later, they might ask the same question again. But let's just get that one out there, because I think that there will be a lot of people who'd be interested. And are you taking patients?
Yes. So I have recently, about in the last 8 months or so, changed my clinic practice to King City.
Okay.
And the clinic is called Improved Care. It's in King City.
Improved care.
Improved Care, yeah. I used to be in Newmarket
Mhm.
for several years, and I transitioned over to this new practice. I
Mhm.
am taking patients. I don't know how much longer, though, I will be taking patients for. My guess is probably at least the next 3 months. I'm sort of very cognizant of not taking on more than I can handle.
Mhm.
So I'm going to put a cap on it, I would say probably in about 3 months or so. But until then, yes, I am taking new patients. Through a clinic in Newmarket, I just go there once a week for patients that are referred to me by other family doctors in the Newmarket area just for mental health. So I do that. And then I also do virtual CBT through a platform that's called TeleCBT. So TeleCBT. And you can get your own family doctor to refer you to TeleCBT. It's a group of family doctors and social workers that do CBT, that are trained in it. And it's all virtual, except for the very first initial consultation is in person. There are offices all over the GTA that you can go to. And then after that, it's virtual, which makes it really nice. If you get your family doctor to refer to TeleCBT, it won't necessarily be with me. There's probably, I would say, about 40 physicians in that group. So you'll be referred, you'll be put with someone. A lot of that is based on scheduling, when you're available, when the physician's available,
Got
all
it.
those sort of type of things, and also what the issue is.
Okay, that's perfect.
Yeah.
That's really helpful.
Mhm.
I know that lots of people are going to be interested. So if we can dive into some of our questions,
Sure.
I have a very basic starting point, which I think will be helpful for all of us, which is
Mhm.
like when we talk about psychotherapy,
Mhm.
what does it entail? And what are some of the common types of therapy that we could, think about?
So that's a great question. Psychotherapy is essentially very generally any kind of therapeutic alliance that you have with a practitioner that helps you with any mental health related issue. There are a tons of different types of psychotherapy models, and they've changed over the years. So that, one that everybody knows about is your typical talk therapy that you see on TV and in movies, where you've got the psychologist or the psychotherapist sitting there, and then the patient is just, venting essentially endlessly, and the psychotherapist doesn't interact much. It's sort of just nodding and smiling that you see. So that's your typical talk therapy. That is quite different than CBT, and I'll get into a little bit more later on, more specifics about CBT. But so that's sort of the basic. And then on top of that, there are different branches of psychotherapy for different mental health related issues. So one is called, for example, DBT, or dialectical behavioral therapy. And that's used a lot of the times when there is some component of emotional dysregulation. It's used in sometimes personality disorders like borderline personality disorder. It's used in different ways, but it's a lot of emotion work and regulating that is DBT. And then there is ACT, and ACT is a lot of empowering, patients, and that's used a lot of the times in, helping with motivation and, for example, weight management or goal management or, commitment to something. So ACT stands for acceptance and commitment therapy. So that's another form of psychotherapy. And then there's mindfulness based psychotherapy. Mindfulness being, sort of being aware of your intention and the reactions and reflecting on your actions. So that's sort of, mindfulness. And we use mindfulness for so many different areas in our life. Again, feeling management. We can use mindfulness for stress, burnout. We can use it for even, relationship matters. We can use it for things like insomnia. There's just, so many applications to these types of psychotherapies. And then there are, psychotherapies that, require you to have a very experienced practitioner that does some sort of, not just talking, but some sort of an active, experience. For example, EMDR is an eye movement based psychotherapy that's used a lot of the time in trauma management. So post-traumatic stress disorder, when people are having flashbacks or reliving a trauma that they've experienced. And then there is hypnosis therapy that, again, works on, changing some of the subconscious thoughts that people have and can sometimes act on without actually being aware of that. So you use hypnosis therapy and things like addiction, smoking cessation. So it's just, psychotherapy is so broad and there's so many different types. Most therapists pick a few different types and get really good at that, and then develop a niche of what they want to treat. And whether it be trauma or, relationship issues, whether it be, for example, depression and anxiety or panic disorder. Some people might choose, personality disorders. So there's a huge variety of things that you can do with psychotherapy in general. And, not all therapists know all therapies, and not all therapists will be able to help you with every type of problem that you might have. So it's important to know what your issue is and then find a therapist that knows how to deal with that issue.
Okay, perfect. I see that there's a questions. There's someone who has put their hand up, and I see a whole bunch of questions in the chat. I want to let you know that I'm not ignoring you, but we're just going to get through some of the bigger pieces of our topic so that we get through all our information. And
Mhm.
I assure you, we will have enough time to actually answer all the questions and for you to bring up the questions that you may not have typed in that you may want to just
Mhm.
talk. So
Mhm.
please hold on to your questions. Don't, put them in the chat. And I will definitely get back to you on those. So this is really good. Thank you so much. You have special, and maybe I've got this wrong, but have you specialized in CBT specifically, the
Yeah,
cognitive behavior? Can you
yeah,
talk a little bit about that?
yeah, for sure. So cognitive behavioral therapy is one of the biggest types of psychotherapy that is utilized these days for many different reasons. One being that its application is very broad. It can be used from things like insomnia to obesity management to anxiety disorder, grief management. It's just very wide, scope of what you can do with CBT. So CBT is cognitive behavioral therapy, and the way I usually describe it to my patients is that if you imagine a triangle, one side of that being your cognitions, which are your thoughts, and within your thoughts are sort of the automatic thoughts that come up for you really quickly without really that much thinking involved.
Yep.
And then there are deeper levels of thoughts, like your core beliefs that are pre-programmed into you from childhood to now. So thoughts is all of that together. And then the other side of it being your behaviors. Behaviors is any action, anything you do. So again, there are your routine behaviors, then there are the ones that you don't do as routinely. So anything that comes under your actions is behaviors. And then the bottom of that triangle are your feelings or your emotions. And feelings or emotions are essentially that one word descriptive of what's going on with you. So it can be anger, frustration, panic, happiness, shock, depression, sadness, fear, whatever it might be, right? And the interplay between your feelings is that what you think can impact your feelings, as well as what you do can impact your feelings. The two arms of it, your thoughts and your behaviors, both impact your feelings. And so in cognitive behavioral therapy, sometimes we do thought work where we are challenging your thoughts at whatever level they might need challenging at. Sometimes we work on automatic thoughts, sometimes we work on core beliefs. And so that's a big part of it. And then the behavioral piece. So we go through, what do you usually do? How do you respond? How do you live your life? What do you do, on a day-to-day basis? And I ask my patients in the very first session, give me an average day in your life, step by step, what do you do, right? And so that then involves behavioral activation. So then we get people to change what they are doing. And when you change what you are doing, you start thinking differently about it, and thus you feel differently. So that's CBT in a nutshell. There are different, variations of this that can be used for different problems. So there is CBT specifically for insomnia. There is CBT specifically for things like eating disorders. CBT for depression, CBT for anxiety. So that is, I hope
Okay.
that answers your question.
Yes, yes. Oh my gosh, I have a million more questions now. I will ask one of them.
Yes.
And that is, what are some of the common reasons why people are coming to you in the last maybe year or so for CBT support or for whatever support?
Yeah. So a lot of, I think the most common things that I treat would be anxiety and depression.
Anxiety and depression.
So whether it be panic disorder or generalized anxiety, people that are just worriers, and or depression and all degrees of depression, from being acutely stressed to mildly depressed to moderately depressed to severely depressed, and the full sort of spectrum of that.
Wow.
So I would say that would be the common things. We do use CBT in other areas as well. So people who have relationship issues, or they have difficulty navigating an acute stressor in their life.
Mhm.
For instance, they were diagnosed with cancer or something like that.
Mhm.
They're going through sort of a turning point.
Mhm.
Many different reasons, but I would say those would be the most common.
Okay. Okay. Yeah, we have quite a bit of, there is one question that since we talked about panic disorders, there was a question about someone asking how to get which clinic to go to. But it sounds like that is something you do. And if there is anything more, then maybe towards the end when we get into this, because there are more questions around that, I'm just planting the seed for you.
Yeah, for sure. Yeah.
Okay.
So panic disorder is something that we can use many different modalities to treat, but CBT is a very common one.
Okay.
And we go through where it stemmed from, as well as what's happening with that. And then there's different activities and different templates that we might use to deal with that.
Okay. Perfect. So maybe this is a good time to ask you,
Mm-hmm.
when is it a good time to see a therapist? Because that's something that I'm sure people are like, oh, well, I know I feel pretty low, or I'm not feeling that great, but do I really need to see a therapist? Isn't that too dramatic? Isn't that like a big deal? Am I making a bigger deal out of what I'm going through?
Yeah.
I don't know. Is that something that you see?
I do. A lot of the times, when people finally muster up the courage to get psychotherapy, they are not doing so great. And at that point, usually some sort of big life thing has happened that has prompted them to action at that point, whether it be, a threatened relationship, or a relationship falling through, or losing a job, or having some sort of family discord, or something happening where now they feel that life is out of control. And now they need to do something. They need to be taking some sort of a step. Ideally, anybody who has any kind of mental health issue that is impacting their day-to-day functioning, that is making them not function the way they usually function, that's when you get psychotherapy. So even if it's, I'm mildly depressed and I have trouble getting going in the morning and I can't get out of bed as easily. I sleep too much, or I sleep too little, I don't eat enough, I've lost weight, I overeat, I emotionally eat, whatever it might be. If this is impacting your life on a regular basis, that's when you need to reach out to someone.
That's really helpful, because sometimes, you don't realize what you might be going through, because you've maybe been sitting in that space for a while, so you don't even realize it, right? But these physical changes or in habits or behaviors would probably be a good indicator, right?
Yeah, and that's, if you've got somebody around you, most of the time, our loved ones will pick up on, you're not quite the same, or there's something going on, right? You're not functioning as well at work. You seem distracted. You have lost a bunch of weight. You find yourself scrolling Instagram at 4 a.m. because you have insomnia, right? So all these kinds of things, there's something going on there. And even before you think about getting psychotherapy, you should go to your family doctor to have an assessment, just have a mental health assessment to figure out, is there a diagnosis? Is there something there, right?
Okay. So you could go to any family doctor and ask them to do a mental health diagnosis.
Yeah, a lot of them are equipped to
Huh.
do so. So the first thing I do when I get a patient is, I go through and I ask them a bunch of questions. I get to know them really well. I go through their past medical history as well as their past psychiatric history. I go through their family's mental health history because this stuff does run in families. And I then do questionnaires and go through the diagnostic criteria of different things that could possibly be going on, because there's often an overlap, right? People can have more than one mental health issue happening at the same time, as well as a particular set of symptoms can belong to more than one mental health issue, right? So let's say someone is really restless and fidgety, right? That can fall under, is it anxiety? Is it ADHD? Is it anxious depression? Like, there's so many different things that it could possibly be. So figuring out what's going on first and foremost is really important. So anyone who thinks, doesn't matter what you think it is, you just have to think something's not quite right, right? And if you think something is not quite right, that's the time to see your own family doctor and to talk about it a bit further. If your family doctor happens to be someone who's not well versed in mental health, most of the time they'll refer you, right? They'll refer you to a psychiatrist, or they will say, why don't you seek psychotherapy? And then they'll give you the avenues that you could do that.
It's a good idea to see a therapist or talk to your family doctor. The earlier, the better. And don't wait for some massive drama to happen in your life. If you're feeling off, that should be a good enough indicator that something could be up.
Yeah, for sure. And the timeline I give people is I say, if you're off for a few days, it's probably just life stressors, right? Something's going on with you. Maybe you're sick. If you're off consistently for weeks, now we're getting to 2 weeks, 3 weeks, 4 weeks, right? Upwards of 2 weeks, something's going on. Right? And as a family doctor, when I see these types of things, I do look for organic causes as well, right? So do you have a thyroid issue? Do you have anemia? Do you have, some sort of tumor? Is there something else going on with you, right? Do you have a vitamin deficiency? There's a number of different organic, physiologic reasons why you would feel fatigued or, have insomnia or have low energy or have weight loss or have poor concentration, right? So we do blood tests and a physical exam initially as well to make sure it's nothing that we can fix with, medication or something else that way, right? And so once we've figured out if it's none of those obvious reasons, it's none of those organic physiologic reasons, and we think, no, this is a mental health issue, which does have a physiologic reason. But if we think that's what it is, then we take a different route.
That's good to know. And for what's been your experience about people leaving it until it's very late? Is it like, what's the result that comes out of that?
It's more complicated for sure. So, I sort of tell people, just generally speaking, if your mental health issue is mild, and it is not causing that much day-to-day impairment in functioning, then we can probably get away with just doing psychotherapy and giving you some tools to deal with whatever is happening, right? Or if it is something that is short-lived, due to something that's, circumstantial, you've just lost your job, that's an acute stressor, you're gonna go through, a bit of, a mental health issue for the first little bit. You will have worries, right? But a lot of that is probably circumstantial. And if it is, perhaps you just need some tools on how to cope, right? If it is something that's been there for a long time It's been there since you were 12 years old. And it's come and gone, it's come and gone. And it's, shown up and flared at times when life got more stressful. So you transitioned to high school, there was something that happened. You transitioned to university, there was something that happened. You were in a relationship, whatever it might be, right? We see these patterns in people's lives, right? And a lot of the times, if it's been something that's been there for so long, has been untreated, and they've had no help with it, and it progressed, moderate or severe, all right? And that's based on the severity of their symptoms and the severity of their day-to-day impairment, right? So, and if that's the case, then psychotherapy alone may not be enough, right? And a lot of the times, people think that a mental health issue is in your head, right? Or it's something that's, a character flaw, or you're just not strong enough to deal with life, right? It's none of those things. We know physiologically there is an imbalance of neurotransmitters and hormones in your brain. We know this. We've tested so many brains, functional MRIs, PET scans, you name it, we've done it, we know. So just like, for instance, diabetes, there's an imbalance of insulin in your body. With mental health issues like depression or anxiety disorder, there is an imbalance of serotonin, norepinephrine, dopamine, and so sometimes people need both medications and psychotherapy. And studies show that when the two things are used together, see if, oh, there we go. Okay. All right. So yes, so with moderate to severe, anxiety, depression, oftentimes you need both. You need to fix the chemical issue in the brain, and then you need to teach the patient how to cope, how to live, how to, rearrange some things in their life to make things easier. And, a lot of these things become an issue when there's imbalance in coping mechanisms, right? So people can have depression and deal with it until it's too much. And now whatever coping mechanisms they have are no longer working. And now the depression is outweighing your coping. And now, you're not able to function. You're not able to do what you would do normally.
Right. So finding that balance between the therapy and the medication, is really where it's really important.
Okay.
And I know a lot of people might feel hesitant to go to a therapist because they don't want to take some of the medication, or like that could be something that there's a fear to say, oh, I don't want to take medication because then that's gonna like really make me feel like there's something wrong with me. Have you experienced that? Or?
Yeah. So when I'm in the role of a psychotherapist, I don't prescribe medications.
Okay.
I just do psychotherapy. When I'm in the role of a family doctor, for my own patients or my colleagues' patients, when they want suggestions on prescriptions or medications, then yes, I'll make that suggestion. And sometimes with my psychotherapy patients, if I see that they're on a medication that perhaps isn't working so well, then because I know a lot about it, I will say, go to your family doctor and tell them perhaps this is a better choice, right? And so they'll take that information back to their family doctor and talk about it with them.
Yeah, and there's a really good point in the chat saying that medication doesn't have to be forever. It can be temporary and you can wean off it. So
yes,
it's not the end of the world.
Yeah. Correct. It's not. There are people with certain mental health issues. They will be on it for a good portion of their life. Right. And there are people, if it's their first bout of major depression, I tell people, I'm going to put you on medication for 6 months. Don't question it until then. If you're doing much better in 6 months, we'll take you off, right? If this is your second bout of major depression, then I will, often keep them on it for a year. Again, things are great at the 1 year mark, we'll take you off, right? It just depends. They are not medications that are addictive. They are not medications that cause physical or a biochemical dependence. So a lot of the times people fear medications because they think, well, I will need it forever, or I will be hooked on it. Psychiatric medication has come a very long way, and we try our darnest not to prescribe anything that you could potentially be addicted to, because that's a whole other problem nobody wants to deal with. Right now we have an addiction on top of a mental health issue.
That's
right?
a great myth to bust.
Mm-hmm.
That's great. Yeah, perfect.
Yeah.
So I know a lot of people waiting to on listening on the call are waiting to hear what are the different ways to find a therapist. Like, where do you start?
Yeah, that's a great question. So more so since I would say around COVID, the government has in Ontario put out a lot of programs for mental health because the need went up exponentially. So there are lots of programs that your own family doctor will be aware of. There's a program called the Bounce Back program.
The what, sorry?
Bounce Back.
Bounce Back.
Yeah, there's a bunch of different ones, but the easiest way to find a psychotherapist is if you go onto the website Psychology Today. So you just Google Psychology Today. It's actually a magazine, and it's also a website. It has all of the registered psychotherapists by area and by specialty. So you can put in what the issue is and where you live, and it'll give you a list. And then it'll link you to their websites. You can read their reviews, you can read their bio and their experience. And a lot of the times, if you have insurance coverage through private insurance, through work insurance, then you will have coverage to be able to get some sessions with a psychotherapist and use your benefits. A lot of the times, if you are unsure about a particular psychotherapist, you can call and make a 10-minute sort of intro session on the phone just to talk to them and get a feel of what their style is like, because psychotherapists range vastly and have very different styles, and your comfort level with them is very important. You need to have that very strong therapeutic alliance to be able to have progress. You need to believe in them for them to be able to help you, right?
That's a really good tip. So I didn't know about this, so that's great that you can call. Like it's standard practice to have like a 10-minute call
a lot of them,
to see if you guys are your vibes match or you're aligned, right?
Yeah. So a lot of psychotherapists will do that are either social workers or psychologists. They will definitely do that because you're paying good money to see them. They can range anywhere from $150 to $360 an hour.
Wow.
So they will give you that 5-10 minute call to just talk to them about what the issue is. And that's always important because you really need to know that that is something that they can do for you, right? You don't want to invest that money and then find out that's not something they do, or, you're not comfortable with them.
Yeah. Okay. So given the pricing, it's good if you do have insurance. It's good to check first to see what's covered and how much and all of that.
Yeah.
Okay. That's really good to know.
And a lot of companies, bigger companies, they provide within their own benefits program access to psychotherapy, right? So there's usually some sort of a number you can call and get it through the company as well.
That's also a really good point. A lot of if you're working for an organization, find out if they already have,
Mm-hmm.
especially now, I think a lot of organizations are really focusing on mental health and wellness. So
Oh,
definitely look into that for sure. And
yeah.
then so there's that. But then there is people like you, doctors like you. Are
Yeah.
you an anomaly? Are there very
So
few doctors who are
to be honest,
also
there aren't that many. It's becoming more of a thing now.
okay?
It really wasn't so much 5, 10 years ago. Because it takes quite a bit of time to become comfortable and confident in delivering psychotherapy. Once people are in medicine and they have a family practice and they're established, they would have to go back and do further training. So, I did my 1 year fellowship. I extended it over 18 months because I was working full time while I was doing this, right? So, not that many people would go and do that to be able to go back to school and work full time at the same time. But there are, psychotherapists within medicine that you can find, but again, they are through these types of programs like tele-CBT, like Bounce Back, and even for certain mental health issues. If you have definitely seen a psychiatrist, oftentimes there will be a social worker or some sort of a therapist that you can access under the guidance of that psychiatrist, because they don't have the time to deliver it, so it'll be delivered through someone else, and a lot of the times that can be OHIP covered as well.
Okay, perfect. So there's an avenue for OHIP coverage as well. And in
Yeah.
that case, you're not paying anything on top, right? It's just
No.
okay. So when someone comes to you for psychotherapy, it's based on what you offer,
Yeah.
it would be covered under OHIP, and they
Yeah.
don't have to pay anything in addition.
Yeah, exactly.
Even if they have insurance, this is still something that's an OHIP thing.
Yes.
And then they could, if they wanted to, if they had the insurance and they wanted to utilize it, they could use that in addition.
Absolutely.
Okay.
Yeah. Yeah.
Okay. Okay.
Sometimes there can be up to a 3-month wait, whether it be through tele-CBT or any other program that does OHIP covered psychotherapy, to see a therapist. And it's just there's a huge demand for it.
Yeah.
And a lot of the times, I encourage people, if you do have any of your benefits or your insurance coverage, use that right away because you have access to it now. So even if you're waiting for OHIP covered psychotherapy, you might be waiting a while. So you want to do something in that time.
Yeah, absolutely.
Mhm.
Absolutely. But this is really helpful. Thank you so much. I wonder if we can quickly just jump to some of the questions, because I'm sure people are like, when are you answering my question?
Can I just add one other thing?
Yes,
So
absolutely.
there are there are two main companies as well. If you have insurance to use towards psychotherapy, if you've got benefits that you can contact without a referral, that will help you link you to a therapist. Now, this is not OHIP covered therapy, but what they do is they try and take whatever benefits that you have and utilize them to the best that they can to get the most out of it. So the two companies that I often will tell people about, one is called Green Space Mental Health.
Green Space.
Yeah. And the other one is called Layla, as in the name Layl. Companies where you can go online, you don't need a referral, you can sign up, you can do, they have questionnaires and intake forms to gauge what's going on with you. They will have somebody who's probably a social worker reach out to you, do a short little intake, get a sense of exactly what you need, and then they will link you with one of their therapists who has an expertise in that area.
Okay. Okay, that's great. So I'll just go, that's really, it's really helpful to have all these additional names. Wow, I don't know, I don't know about people who are listening, but I've learned a lot for sure. So I'm just going to go through the questions.
Yeah,
And
sure.
so there was someone who was asking if a referral to you is required. And I think you said yes, right?
Yes. Yeah. So if it's through tele-CBT, then yes. Your family doctor can fill it out and fax it to tele-CBT. And if you go to tele-CBT's website, the referral form is right there. Or if you put in tele-CBT referral, they'll do that.
Okay.
And if it's in my Newmarket clinic, then yes, it's a referral from your own family doctor, just giving me the nuts and bolts of what's going on.
Okay.
And they would
So there's a
fax.
lot of questions about your Newmarket clinic. So
Yeah.
can you just tell us a little more again, just to what's the name, what's the process of how to get to you?
Okay, so the one in Newmarket is at the corner of Bayview and Mulock. It's in the medical building at the corner there. I think it's 535 Mulock Drive.
Bayview
And
and Mulock. Okay.
yeah, Bayview and Mulock in Newmarket. It's the medical building there on the corner.
Mhm.
And the clinic on the ground floor is where all the family doctors sit, and it's called All Med, ALLMED. And the referral would have to come to All Med, so you can look up their fax number, whatever it might be, and a family doctor can refer to that clinic, and I can see them that way. Alternatively, you can also send the referral for CBT to my Newmarket office, and there are some patients that I can see there as well.
Your Newmarket office, this is the one in King City?
Sorry, my King City office, yes.
Okay.
Yeah. So
Okay.
majority of the psychotherapy that I do is out of the Newmarket office. There are a handful of patients I will see in King City that are not my own patients.
Okay.
Because King City is where I have my own established family practice. So I'm usually seeing my own patients there.
Okay. So if someone um wanted to see you,
Mhm.
what's the best way to get to you quickly?
So I would say probably getting a referral to the AllMed clinic in Newmarket.
In Newmarket. Okay. And then if they want to become a patient of yours as a
Yes.
family doctor, then it's
Yes.
the one in King City, which is called Improved Care, right?
Yes, you got it.
Okay,
Mhm.
perfect.
Mhm.
Just clarifying, because I'm sure there's people who have lots of questions about this. And then you said that for tele-CBT, you can get your family doctor to refer you to this, so that's good.
Yep.
There's a
Mhm.
question here on how long is the experience with psychotherapy? Like how is there a time, roughly a time frame, or?
Yeah, for sure.
Okay.
So, in my intro session, I kind of go through, what it's all about, what to expect in each session, how long sessions are. So what I tell people is CBT is very, very goal-oriented therapy. So I tell people, if, pick one or two things you want to work on. Give me one or two specific goals that you think are going to improve your day-to-day life as best as you think, it can be. And CBT is present oriented. So unlike other types of psychotherapy where we're going and delving into your past and maybe trying to deal with past traumas, this CBT is very much what's happening in your life now. How can we help you the best today? And so I tell people it's going to be somewhere between 8 and 16 sessions to really give it our all on those one or two goals that we set. And
Okay,
if
8 to 16, 1
Yeah.
hour sessions?
Yeah, so they're usually about 60 to 75 minutes.
Okay.
And in the first handful of sessions, I do them weekly because we want to get the ball rolling and we want you feeling better faster. Then sometimes when you are doing better, we'll space them out and they'll be bi-weekly. And then sometimes, when you're done your, sessions for that particular one or two problems, we will sometimes go back a few months later and just do a check-in and see how they're going. And I tell people if we've really worked on those one or two goals that we've come up with, and we have accomplished those, let's say by session 8 or whatever it might be, and now you've got two other separate issues, right? We can do another set for those. But I
Okay.
like to really focus on, what the issue is at hand first, and not stray,
Everything. Yeah.
stray off course and mix up too many different things that are happening.
Okay. Perfect. Perfect. I think there's a call for asking more about panic disorder, but we'll come back to that because I think that could be quite a bit of that could be a longer conversation. But
Mhm.
you did say that for panic disorder, CBT is one of the
Yeah,
therapies that can be used, although there are others that could also be used. I remember you
yeah,
saying that.
yeah.
Okay.
CBT is
Perfect.
very effective for anxiety and panic disorder.
Perfect. I don't know if we've asked this question or you've answered it somehow, but you don't have to be we don't have to be a patient of yours to get therapy from you, right? If the referral is good, right?
Yes,
Yeah.
yeah.
Okay.
So it is limited how many hours in a week that I can do psychotherapy. So it might take some time to get in to see me, because, it's not like regular family medicine where an appointment is 15 minutes. This can sometimes
Longer.
be, yeah, an hour to 75 minutes per patient. And I usually do it 1.5 days a week. So it can take a little bit of time to get in to see me just for
Okay.
that reason.
That's good to know. That's good
Mhm.
to know. And then thank you so much. Someone has actually, Zainab has sent the tele-CBT link. So thank you for
Mhm.
that. Let's just go further down. Okay, so someone's asking to please discuss about panic attacks.
Mhm.
But before we get into that, a quick question. Can couple counseling be done at the All Med clinic in Newmarket by
So
you?
at the moment, I'm not doing couples therapy.
Okay,
I'm just doing individual therapy. There are some CBT practitioners through tele-CBT that will do
okay,
group therapy or couples therapy.
okay.
At the moment, I'm not doing that, but others, you can certainly find that.
So couples therapy go through tele-CBT.
Mhm. You can
Perfect.
ask them. Again, there aren't that many through tele-CBT, so it might be a bit of a wait. If you have insurance, you can certainly find a good, couples counselor that route as well through Psychology Today or through even Layla or Greenspace.
Okay, perfect. So
Mhm.
let's roll down to the panic attacks.
Mhm.
Is this something that's fairly common that you see, or is it
It is fairly common.
okay?
Yeah. So, what specifically do they want to know? Is it, what's going on there? Why do people have panic attacks? What do we do for panic attacks?
For the person who's put the question about panic attacks, if you're comfortable, feel free to unmute your mic and maybe explain a little more, and maybe we that way we can directly
Hi.
understand. Mhm.
Hello. So I have put a question regarding the panic attacks. So
Yes.
I have been diagnosed with the panic disorder since 2016. And there are some times that I feel good, but there are some times that I get a lot of panic attacks and I cannot control myself at that time and I have to land in emergency every time.
So without me doing a proper assessment and knowing whether it's mild, moderate, or severe, and also knowing if there is any other concurrent mental health issue, I cannot tell you if you need medication or not, or if you just need psychotherapy. But what I can tell you is that with CBT, have you done any therapy at all? So, unfortunately, talk therapy does not do much for anxiety disorder and panic disorder. CBT is a little bit more focused. So, the first step would be for me to explain to you what is the premise, what is the underlying reason, why do you have a panic attack, right? And for you to understand what is happening, because there's no way that you can try and mentally control something that's happening to you if you don't understand what's happening to you. So we go through, what is a panic attack? Why does it happen? What's going on a physiologic level? what can you do? There are so many different techniques that we can teach you to control your panic disorders. You don't always need medication. People can do it without medication, but they have to be really motivated to utilize the techniques. So usually I equip people with a toolkit. That's what I call it, of a bunch of different techniques. From sometimes, it'll be grounding, or it'll be box breathing, or it'll be utilizing progressive muscle relaxation, or it'll be a whole bunch of different types of things that we can do to de-escalate a panic attack and help somebody deal with those on a regular basis. So when I hear the story of somebody going to the Emerge often, you certainly need to see your own family doctor, and you need to get some psychotherapy, because panic attacks are not going to kill you, and you also know that there's very little that an emergency doctor can do for your panic attack, right? And so that's the importance of understanding what's going on in your body and what's leading to that. It can feel like, you're having a heart attack. You're gonna die, right? You can feel all of those things. So we teach people, how do you differentiate truly having a heart attack or dying from a panic attack, right? And so you have the confidence while you're sitting at your home having a panic attack, not to go to the hospital, not to call 911. Instead, how do you deal with it? And then you can use those things in your toolkit that we teach you.
Thank you so much. This is really fascinating. I'm just conscious of time, and I want to make sure that we're respecting your time. That was like fascinating to hear, and I really appreciate you taking that time. I just want to, there's one last quick question,
Sure.
Which is, can psychotherapy or CBT help someone with ADHD? And do you help treat that?
So yes, I do diagnose ADHD all the time. I do treat it. ADHD, there are parts of CBT that we can help you with. But usually there are, ADHD coaches, and it depends on what age group you're talking about. So if it's a 7-year-old child, it's going to be different. If it's a 17-year-old, it's going to be different. If it is a 27-year-old, it's going to be different, right? Yeah. So again, speaking to your own doctor, and again, a lot of people have ADHD. Some people have great ways of dealing with it and coping with it. And, it doesn't significantly impact their productivity. Yeah. And some people don't function very well, and then it does. Just what I will say about ADHD is a lot of people, especially in the South Asian community, when it is a young child or a teenager, think it's a behavioral or disobedience or a parenting issue. It is absolutely not. And for those reasons, people don't seek out advice or treatment from their doctor. And they also get worried about the label and the stigma. Yes. If my child is diagnosed with ADHD and now they need an IEP in school, what does that mean? They're never going to be successful. They're never going to become a doctor. That's not true. Chances are, if you don't treat their ADHD, they certainly will not be successful, because it leads, when they have difficulty doing normal tasks that are expected of them in our school system, and they fail, their self-esteem goes down. And then that ADHD that's untreated will lead to an anxiety disorder and will lead to depression. Yeah. So
you've made a really good point, where you talk about, when we asked about when is it a good time to go to a therapist. I think when you feel that you have an issue, you first need to treat the disease of what will people think, which is in our communities, right, and ourselves. So that's great. Thank you so much. This has been fantastic. And I really appreciate your time. And I know that, Sajida did mention in the chat that if you do need support, and you know, you don't have insurance, or there is some kind of financial implications, or even you want to talk through some of the therapist, that Salam Foundation absolutely does help with that. And Sajida, hopefully I have not spoken out of turn when I said what I said.
Especially with single parenting.
Mhm.
So we are very big on supporting single parents with mental health, because
Mhm.
that's how you help the kids. So contact Salam Foundation at salamfoundation.ca. If you go there, there's information how you can get a hold of us, and then we can process you and get you a mental health practitioner to help you.
Perfect. Thank you so much. Really appreciate your time, your expertise, your just knowing so much more about what's out there. And I think that sometimes we feel that getting the help for mental health is too big and it's too overwhelming. And it's so good to know that there are ways to make it easier to get access to this. So we really appreciate your expertise. Thank you so much, Dr. Hadi.
Thank you so much for having me. It was great chatting with you guys, and I really enjoyed this. And if there's ever a time you want me to specifically speak about any one particular diagnosis, whether it be ADHD or anxiety or whatever it might be, I can do a session dedicated to that as well.
Excellent.
Thank you so much,
That's
Dr.
great.
Hadi.
Have a wonderful
Yeah.
evening, everyone.
Thank
Thank you for
you.
Take
Hannah.
care.